Welcome to Investing in Impact. This is a Will Grow Africa podcast, and we are so excited about this special season of Investing in Impact on the sidelines of the International Development Innovation Alliance Summit being held here in Nairobi. And this is the first episode of that season where we are having a conversation around innovation under pressure.
So in a single sentence, what's the biggest pressure you're facing as an innovator right now?
As an innovator, the biggest pressure that I'm facing is funding, and I'm sure I'm not the only one. It's a really challenging environment to find funding, find contracts, find grants.
One of the biggest challenges, again, in terms of accessing the right funding for the stage that we're at right now. We need to be able to access funding that can help us de-risk business model validation, because we're trying out different models. We're selling directly to NGOs. We're also looking at community sales and retail, and we're also looking at strategic partnerships. But for some of those, we definitely do need partnerships and capital to help us expand our team and deliver within the markets that we're working in to see which business model will deliver the business expansion.
On today's episode, we explore a critical question. When money runs out, can health innovations built with donor funding stand without it? Across Africa, health innovators who once relied on traditional aid are facing a new reality: adapt or disappear. Today we'll hear how some are not just surviving this pressure, but are using it to build something more sustainable. The question isn't whether funding will shift. It already has. The question is, what happens next? So to begin this conversation, I will invite you, Tonny, to, as the head of Kenya's innovation agency, KENIA, talk a bit about how innovation led by agencies such as yourself, KENIA, shift to actively stimulating and sustaining innovations, especially when external aid is uncertain.
One of the shifts that we've done is pay attention to entrepreneurial leadership.
Yeah.
Pay attention to innovation maturity. Two things. Now, innovation maturity to us means, let's take a private company or a research institution or even a government institution. We support a lot of governments, or a university. In that ecosystem, depends on how you look at yourself. If you look at yourself as just teaching and learning and graduate degrees, then you'll start panicking that the donor stopped giving you money. Mm-hmm. But if you see yourself as an entrepreneur ecosystem that creates value, that identifies a market, that leverages the capacities of the students and the faculty, and the capacity is some of the outputs, the entrepreneurial spirit in them, and then provide the leadership and the atmosphere that enables them to create commercial value, then you don't panic, because you just start asking yourself, one, are there resources internally here that are being underutilized? Are there outputs that we've never taken advantage of? I have worked to research institutions and I'm like, oh my goodness, for all these years, all these products have been here. Mm-hmm. I mean, like nothing has ever been done with them. Okay, so that's a big question. So, but I don't want to be the one thinking. I just have to help you to think.
Yeah.
Mm-hmm. But otherwise, you will also say, when are you coming again to help me think?
Exactly.
Yes.
All right. So we help institutions now with a maturity framework that helps you to self-assess on where you are at in your entrepreneur and innovation capacity. Mm-hmm. And I've listed out a couple of things: your infrastructure, your policy, your teaching and learning. Yeah. Ask yourself about the entrepreneur teaching and learning. Mm-hmm. And when you did a course on entrepreneurship, what was it for? Mm-hmm. Was it for a grade, or was it to spur entrepreneurship in you? Mm-hmm. And I've asked people to teach entrepreneurship and said, okay, so what is your desired outcome? Mm-hmm. And are you happy with all the work you've done the last 3-4 years? And then they go like, I'm actually debating whether that was there is something missing. And I said, okay, time to reflect on entrepreneurship education. I go and look at institutional leaders, and I ask vice chancellors, for example, how many of you consider to be entrepreneurial leaders? hardly do they raise up their hand until I define it. Once I define, then they go like, oh, actually I'm an entrepreneur leader and I haven't been exploiting this opportunity. Then we've created training programs for leaders, institutional leaders, telling them that you may be technical, but God has given you an opportunity here to spur energy of other people towards greater outcome of themselves. So you're an entrepreneur leader. And what does it mean? I take you through the kind of a training of what that really means. How intentional are you as an institution to create value? Because we always think of innovations kind of like an accident. Yeah, like, okay, I was sitting under a tree and then I fell off a tree. And then bingo, I had some great moment. No. Our approach is that it has to be intentional.
Yeah.
You have to have portfolio, you have to think about what milestones, you have certain amount of time, you have certain budgets and so on and so forth, and what is the follow-through mechanisms and so forth. So these are the elements we are mainstreaming in institutions that really nothing much changed. It's just the source reorganize itself. We need to figure out an opportunity will meet a prepared mind. We can't sit and cry about anything. Fine, let's adapt. And surprisingly, there's a lot of resource internally to be used. There are new funders. Like I said, it's about access to funding. And so we're now looking specifically, who are some of the funders who would align to some of the things we want to do. So I've talked a lot of mindset, frameworks, entrepreneurial leadership. And for us, honestly, there is no change. It's just that things reorganize themselves and those who adapt better exploit. I'll speak a little bit to the Pan-African Network of Innovation Agencies because we also realize the power of connecting across Africa.
Before you go into that,
yes, please.
I really like your framing of this subject to access to finance. Yes. I really love that. And I like what you're saying that as long as you're able to add value, you will find a market and you will be able to attract capital. So no need to panic.
No, there's no need to panic. The market has not gone. Yes. The market is still there. It's the same as it was, right? Value is what does the market need? And so I see problems, I see challenges, and I figure out how I get started and I create new value that is sticky, and I think through business models that will deliver this value to these stakeholders. And funding will come because there is value that is sticky enough. And by the way, I have been a big, don't quote me, but anyway, I've really struggled. I have really struggled with donor funding in the context of entrepreneurship and innovation. Yes. Why? Because it's relatively passive, not relatively, significantly passive. In other words, if I give you a grant today, you don't lose sleep at night. You actually sleep more. Why? Because you're like, look, I have a runway. So you kind of like slow down. You kind of like, okay, now I can get this thing down. Let me be consistent and so forth. But you see, if I give you an investment, you lose sleep that night because there is return on investment expected. So, and that shifts orientation. So funding didn't go anywhere. It is somewhere. It is probably just shifted. And it probably shifted to our advantage. And I think we will innovate more because there's some pressure.
Wonderful. So innovation under pressure, you're saying we now have the right kind of pressure to actually not stop us from innovating, but to actually spur us to innovate more.
Yeah.
Wonderful. And I want to bring you into the conversation, Evelyn, because you work at Science for Africa Foundation.
Yeah.
And I do know that part of what you're trying to do is to help scientists shift in their mindset from being researchers, producing research outputs, publishing, to generating the kind of value that Tonny is talking about.
Yeah.
But for that to happen, we need to think about business models. So in this context, what kind of business models do you think we need to successfully deliver that value Tonny is talking about to markets, especially in healthcare?
Yeah, great. Picking up from where Tonny, he's actually really set the tone for us. So I'm Evelyn Gitau, as you mentioned, from the Science for Africa Foundation. a foundation that funds research, but we don't fund research for research's sake. Our mission is to transform lives. So if we start from that point of transforming lives, we're already saying that science and research in itself is not the end game. It's the life that we want to transform. I was reflecting on a conversation we had a few weeks back as Tonny was speaking, and a question that we've been debating, in the transition of how research is. So personally, I'm a scientist. I worked at the Kenya Medical Research Institute. I was a biochemist, cellular immunologist on the bench. I got patient samples. I did my analysis. I put my results, publish or perish was really our goal, right? So the more papers you had, the more you would get promoted. And that's the model academia still exists in. But we're also in the season where universities are being questioned around their value, right? I like the way Tonny has framed the entrepreneurship leadership. So scientists like us, so I'm a chief scientific officer who looks at our science portfolios at the foundation to say we need to add value to transform lives. We're suddenly being asked to be entrepreneurial in how we think. Sometimes I tell people I went to the bench because I'm an introvert. I like playing with things. But suddenly I've become a marketer of people science, and really believing that science can make the change that we need to make across the continent. So the shift I wanted to talk about is we started off, when I started in KEMRI in 2002, our proposals used to say study subjects. Now, that was wrong in so many ways, because these are the people we're saying we want to transform, right? But we're calling them subjects. My friend Wanjiru Rutenberg brought me the idea of, but we are all citizens. We're not subjects of any government, right? So so we moved and shifted from study subjects and rebranded everything that we do. And any participant who was coming into our studies, we started calling them study participants. But then, actually, the question you asked and the idea that they are participants, not our clients, not our customers, is a problem. Because in itself, it means we're asking them to participate in something, but they haven't demanded for that something we want to give them. So if we start thinking about governments, hospital participants as clients, as customers, then we have to shift how we think and how we teach academia and how we teach research. They're not subjects anymore. They are clients. What do they want from us? They want things that will help them change. So the business models, or even the ones I'm seeing succeeding, the innovators who we funded who I'm seeing succeeding, are the ones who are going in here saying, if I do this research, it will increase efficiencies, the service delivery. It will transform or disrupt how we work. Not everything disrupts, but actually, in a way, it could also ensure that people access things that we thought were low-hanging fruit. I like giving the example of cold chain. Cold chain, vaccines and cold chain are hand in hand. So how do you get a vaccine to the client? Let's move away from the participant to the client, right? 30 years, we haven't solved cold chain. And now we have climate, for example, that's come into play. And now suddenly we have to really think about cold chain again, because we worked on how to make the vaccine more stable, but there's never a 100% chance that vaccine will not need a fridge.
Yeah.
And to get that vaccine to that child, we have to think about cold chain. 30 years, this has been part of my life, cold chain. So it's because we actually haven't thought about who's paying for that cold chain, because donors have funded cold chain, supply chain. Donors, the Gavis are great. We were watching carefully last week when the global fund replenishment was happening, the Gavi replenishment was happening, because we haven't shifted mindset. We're just worried that our cold chain will be maintained by someone else's money. So the business model that I think we should be driving is moving away from impact-driven, how many lives saved. It is important to save lives, but it is more important that we can save lives in a financially sustainable way, because there is nothing as bad as, a mother like me. When you go to the supermarket and the thing you're sure doesn't cause a rash on your child is no longer there.
Yeah.
right? And this is what we scientists do. We create something, we test it in a population, we're given, 200,000, and we know it works, but we've not thought about the fact that we need now to scale up. We have a moral imperative to scale up. So the things we need to do, the models we need to do now from a foundation perspective is catalog what exists, because we don't want to keep duplicating, because a lot, as Tony said, in academia exists. There are a lot of innovations. But we need to get the scientists to either start talking the language, or we need to bring the MBAs, the business models that have the people who understand business to start having the conversation, not at the end, at the design level. I've always admired Stanford Seed. When we started Grand Challenges Africa 10 years ago, Stanford Seed was coming into our market in Kenya. It's that pairing of the Strathmore MBA and the chemists in Chiromo, in University of Nairobi. It's that pairing that has to happen, not at the level of you need to make it a business, but at the point of what am I making, how am I designing it, and what do I need to make it cost effective and efficient so that the government can see it as something that will actually change and the Treasury will say this will actually save us money. So maybe, I don't know if I've answered your question, Moses, but these are the things that actually keep me up at night now is how do we change people? How do we teach better in universities? IP, I mean, you would imagine IP offices exist in all our research universities. Actually, less than 10% of them have IP-ready people to help researchers actually think about IP. And what we know is venture capitalists are not going to come when you've already published. So we need to go hand in hand, right? You need to publish and have that IP at the same time. It's not either or, but it's making sure that that's happening. So when we are evaluating researchers, when we're saying a PhD has succeeded, IPs in China are the first thing they look at, and publications at the same time. We can do the same thing. Yeah.
You've raised a lot of important issues. You've talked about reframing impact so that we're not looking just at lives saved, but lives saved
In a sustainable way.
sustainably.
Yeah.
I really like that because part of what I do, actually, I lead M&D at Vilgro Africa.
Yeah.
And so I'm the one who does the counting of the numbers and the aggregation and the reporting. So I understand exactly what you're talking about, that we have a big problem of mindset. So that as much as we're talking about the right business models, we need to dial back a bit and start to think about the entrepreneurship thinking from the get-go.
From the get-go.
So that the knowledge producers we have in academia begin by starting to ask themselves, I'm creating value, who could pay for this? Back to Tony's point. Now, I want to shift the conversation a bit and bring you in, Yasmin, because you're on the impact front. You lead in supply, and I'd like you to talk a bit about your company and what you do. And then tied to that, if you could speak to the stories of real people that you've created change for, and then on top of that, maybe address this tension about the lives reached versus lives reached sustainably, and where in the context of where we are today.
Thank you. So, as you said, Yasmin Chandani, I lead the InSupply Health team. InSupply Health is an East African organization. We're focused on, we also have a mission around transforming lives through two avenues. One is building resilient, people-centered supply chains, and also shaping the markets in which these supply chains operate. And I feel this is a perfect setting because I think between Tony and Evelyn, you've framed it so well for the work we do and also the mindset we have tried to infuse as we started InSupply. So in starting InSupply, actually, I would call us a social enterprise, although we're still fairly young and haven't fully achieved sort of that sustainable model. But our vision was always, when we started, is to look at an organization that served public and private sectors, but that was not a donor-dependent organization. So, to the tension you talked about with grants giving you a lot of complacency, right? From the start, we tried to set up InSupply in a way that we said, if we look at the impact we want to have and the transforming lives, supply chains, it's very hard to measure lives saved directly through supply chains because supply chains serve health facilities. When a supply chain works well, you actually never hear about it. It's only when the supply chain doesn't work well that people are like, where's my COVID vaccine? But I don't have potent vaccine. Where's my ARV? Something like that. But for me, I had worked in supply chains for over 20 years. And for me, it was very important that we innovate in the area of supply chains within governments. So we started out knowing that government was one of our first most important clients, but not only government. 50% of our people access healthcare through the private sector. And if we couldn't bring that innovation to the private sector, then we were doing a disservice to our mission and to the people in the countries we work with, Kenya, Tanzania, and now we're in Ethiopia and Uganda. And one of the things the beauty about supply chain, it's always been very client-centered, and it's always been about efficiency. It was at odds with the way some donors were funding supply chains because they didn't prioritize the client aspect or the efficiency. And our mission was to try and change the way governments and private sector did supply chain with these two things in mind. So one of the stories I'll talk about is how we have partnered. And so with that in mind, as you said, we always thought about innovation very intentionally. We are going to use a human-centered approach to innovation because we're not the ones who have to live with the solution. Yeah. We don't even understand the problem fully. We need to speak to the people who live with this pain, and they need to be part of the solution building. And so that's how we started. And the second thing is, I love what you said about innovation, which is just about any change that brings joy and happiness. We don't think of innovation only as technology. One of our most powerful innovations has been a process and people innovation around data use. Data is the new gold. We still work with government counterparts who don't understand how data can transform their lives and really help them be more efficient, make better decisions. And so that's one of the innovations I'll talk about today in terms of your story that I'm very proud about. But one of the things is it takes time when you're working in a government system because you have to do that human-centered piece and make sure it's not your assumption of the problem you're solving, it's the problem they want to solve. And, I really liked what you said, both of you said, about do we think about cost from the beginning? And for us, we do not go down the path of innovation if it is not scalable or sustainable. We discard and have discarded so many great ideas because I know it's not going to work in a government setting, right? So we start from that premise. The people's voices who are going to live with the solution have got to be part of design and implementation. So we do a lot of adaptive learning along the way because even when, as good as your human-centered design is, you never get it right. You have to keep adapting it to make it work. And there are systemic shocks that happen. You've got to adapt to those. And the other thing is, from the start, we haven't gone as far as thinking of total cost of ownership, but we do think about, is this affordable? Is the capacity easy to build within the system when you're thinking about how to scale this, even when we don't know if it's going to work? So one of the innovations we've worked for the last 2 to 3 years with two aspects of the Ministry of Health, the Department of Health Products and Technologies and DRMNA-MCH, which is the reproductive health team. When AI started to be something that we knew could really transform, it's become a buzzword now, but 3 years ago, ChatGPT wasn't on everyone's laptop and it wasn't such a big, we hadn't demonstrated how widespread it could go. We come from the mindset of thinking of operational AI, not necessarily clinical AI. They're very different. And operational AI is low-hanging fruit. It can be transformative. It'll address those hidden bottlenecks that really stop people from being effective in their role, scheduling, planning, all these things. And so we said, what if when we looked at the biggest problem that supply chains face in many countries, but especially in Kenya, how do we make sure there are products that will save lives available whenever they need to save lives? And there are many drivers. One of the biggest ones is poor forecasting, supply planning, which affects financing and procurement. We thought, what if we try and tackle this one? It's a big one, but let's try. And, we work in 5 counties. The counties and DHPT and Duramka were on board with this. So we started this co-creation process, and we actually did it in Tanzania as well. And essentially what we did is developed, and this was really interesting, we developed an AI-based forecasting tool that is designed to help both counties and the National Program for Family Planning do their forecast more efficiently and effectively. The goal was never just efficiency. It was also, there are problems, which is why we don't have. So what was really interesting is when people are so far away from that transformative change, sometimes that outcome is not what's going to light them up. You have to address their immediate pain point. And the immediate pain point we addressed was just processing data. We helped them go from 2.5 days spent, or sometimes weeks actually, at the county level, extracting and cleaning their data. And they did that in 10 minutes, right? AI can be so helpful with that. The data was extracted from our national systems, KHIS, and cleaned. And we use this human in the loop touch point, so they still feel in control. And, to the points of affordability, we use open source tools. I mean, everything was done very intentionally. So now suddenly they have their data in 10 minutes. And those 2.5 days they used to spend, they can spend it on higher value tasks. They can start, we analyze the data and present it back to them. They can ask questions. They can challenge each other and say, is this really what we want to spend our money on? And the story I want to say to you is we're really excited about this. So in those 5 counties, 3 of the counties used the outputs because now they were involved at every stage. They weren't they didn't delegate the data extraction and cleaning to someone else, and therefore they didn't understand the data. Now they were end-to-end involved in this process. They knew exactly what the output said and what it meant for, there are 4,000 products. They need to figure out how to pay for and buy at the county level and make sure that those 4,000 products are there at all the levels to save the lives they need or to make the impact they need. So now 3 of these, county teams, we work mostly with the health management teams, the pharmacists, and, the heads of programs. They went to their CEC and their leadership and made the case. Isiolo managed to increase their budget allocation for commodities by 108%. And maybe I shouldn't have named it, but 2 other counties managed to also improve budget allocation. And then guess what? They came to us and said, so you solved half our problem. And when we did our initial HCD, this did not come out. We have another problem now. We have 2 billion. Our forecast says we need 2 billion shillings worth of money. Last year, Treasury only gave us 700K. This year, they've agreed to increase it to 1 billion. How do I go from this list of 4,000 products for 2 billion shillings down to 1 billion? I can't do this in Excel. And we said, okay, we went back to, and this was a donor, but we had promised the donor we were going to develop something that was embedded and sustainable. How do we get, so we said, okay, we can do this again with AI. So we developed another tool we call the SMART tool. And this is where, so what it does is it uses algorithms that we built with the counties and best practice. So there's a concept called ABC then, and that's how you prioritize. But also they brought in things like workload. They brought in other factors. They brought in their list of life-saving commodities. And each county has a different list, right, based on their health outcomes. So we built those algorithms into the tool. And now at the facility level, which has saved so much time, the facility gets that this was their forecast. This is how much money they have. The tool helps the county delegate the money. The facility can decide, basically, here's the list that the tool recommends. They can change that list or go with it. And it has changed the turnaround time for decision-making, for financing and procurement from 2 weeks to down to, again, an hour, maybe 2 hours when they sit as a team and decide together. And the county now gets this aggregated list. And because don't forget, that 1 billion doesn't come in one lot. It comes in tranches. So you have to think to yourself, I don't know how to do this. And so what they used to do was just default to whatever was ordered last year. This is why you have chronic stockouts and overstocks, wastage. You know? So now they have this tool that they can use and now they keep giving us more. We need it to do this and this and this. But to me, what is the victory in this is that it addressed efficiency for them. It's too early to measure the effectiveness. We look at forecast accuracy, but that's something we want to look at to see, did it increase the number of products from a life-saving or, critical perspective at level 2, level 3 hospital that made this effective. And in the meantime, the national program has embraced the use of this tool, and we're working to transition it to DHA and ICT. The one thing I would say that comes to some of the topics that Tonny and Evelyn have raised is there isn't really a framework that we found within government about this total cost of ownership. So there's still questions about, who's going to pay for data hosting. I mean, we want to embed this in the DHA, the digital health agencies. They've got a ecosystem. Yeah. We want to embed it in there. But, there's still sticky questions about who's going to do the technical upkeep of this tool, who's going to host the data. The ownership, they feel totally owned, but those are still questions we have to address. And when it comes to InSupply as an organization, our goal now is to, because a donor, and I think this is the flip side of what you said, because we don't want to be complacent about what innovations should do for the ecosystem, we're testing this business model now. It's not yet fully tested. But the idea is a donor paid for 80-90% of this work to be done. Why should this innovation only serve government? Can we pivot it and serve a segment of the private sector that can't afford those big AI softwares, the global tools? But there's small networks of health centers and the smaller hospitals who can't afford to invest in AI. Can we pivot this tool, make it available to them as a fee? Not because we're not, our goal is not to make millions of dollars, but can we generate revenue to be sustainable? So really that's where we're coming from.
You've answered the question that I was going to ask you next, because you're saying you've created great impact, you created value, and that's obvious. The question then is, now that you were able to do this through donor financing, how do you sustain it? And you're saying that you're going to now take this to market for the private sector.
Exactly.
Wonderful. Now I want to come back to you, Tonny, and your network of government innovation agencies. So if you could speak a bit to what kind of mechanisms are you thinking about at that level to ensure that across the continent we're creating this value and building businesses, and how are you thinking about supporting them from idea all the way to market?
Thanks very much. So we started this network because we realized a number of issues were not working very well for us here. One is we are not speaking the same language about what innovation is and should be. We were not collaborating much. For 4 years or thereabout, when I got into the innovation agency, I kept on wondering, is there any forum or any platform? So I noticed there was a gap there. I noticed a challenge of moving an innovation from one country to another. We talk about flight problems, that for you to go to Congo, you go to Europe and then come down. So we noticed that taking product to another country, in South Africa or in Tanzania, I need a soft landing platform. I need somebody to receive me and give me quick access to the environment. If I can't facilitate that as an innovation agency so that an innovator succeeds in making it work in another country, then I will not be very useful in that context. And if we keep talking about markets for innovation, then we need to find a way to support this. Policy issues across countries also is something we thought there is an opportunity to try and harmonize a few things here and there. So that's the genesis. Now, As an innovation agency in Kenya, we had already started working on these commercialization path issues of research outputs, for example. It's one of the pillars of work that we really do, and we've demonstrated what it means to do research commercialization. We've got ventures that we've actually created. We've even put together a fund to support early stages of that maturity issues. And we've seen startups scale as a result of that shifting them from just seeing themselves as a publication only into enterprises. I engage a lot of DGs and CEOs and vice chancellors around their support mechanisms. For example, can a faculty member get time off for 6 months to concentrate on their venture and not lose
The position.
whatever that is? In fact, we have one vice chancellor who said, I will even give money. Not only will I give the time, I will also give money. Now, that's an entrepreneur leader.
Exactly.
Yeah.
Who's now seeing that I have a role to play in making that happen. Okay, so we have a bunch of success stories. And the question then was, how do we replicate this across many other countries? How do we share knowledge? How do we inspire? I have examples when we started doing the Kenya Innovation Week. Now Uganda started to do it. South Africa is planning to do theirs. For us, we've been running for 3-4 years. Now they're starting to do it. And so far, we've got 9 countries have signed up into this network. And we formalized now, we've got funding, we've got a secretariat in place, and we've got a steering committee. We're putting together an advisory committee. It's exciting to me how much the countries, individual countries, want to put their skin in the game. In other words, they're not waiting for the secretariat to design this network and programs and so forth. We're already piloting joint projects. So we look for a project in Kenya, and then we say, Tanzanians, you will offer access to market. You will address the access to market. We will address the issue of technology development. And then we'll say, okay, Rwanda, you will help us think through the commercialization and tech transfer and the IP issues. And then they work together. And then next thing is I see they're rolling out a project in more than one country. We have agreed to put together a soft landing program or a framework that enables countries to effectively receive, comprehensively support ventures from other countries. We are scaling the R2C program, Research Commercialization Program, based on the lessons we've learned. We're putting together a Pan-African Innovation Fund. We're designing that fund to support as much of what we can. We're looking to formalize and make it more of an institution. Currently, we are hosting it within the Innovation Agency in Kenya. But I see an opportunity for knowledge exchange, capacity building. We've done a couple of training programs on what it means to build successful innovation ecosystems that are resilient, that are not going to look at the pressure negatively only. I'm not saying there's nothing wrong with that pressure. There is something negative about it, but then you don't stick there. You look at the positive side and build on it. And so that's the journey we're walking.
Thank you very much. I really like what I'm hearing, and it gives me a lot of hope, personally, as an African person.
Thank you.
Because, with the work we do across the continent as Vigro Africa, we do see pockets of success. But one of the big challenges is, as you said, it's very difficult for startups, for innovators to work across borders.
Yeah.
And if you can't access the continent as a market, sometimes the cost of generating this value is so high that if you're restricted to your own market, then we may not be able to get return on that investment.
Exactly.
So this is a crucial and much needed intervention, and congratulations on the good work.
Thanks very much. I mean, I will tell you a very small story. We started by building a network of universities. It's one of the things I try to do in Kenya before we went into Pan-African. Because many times universities don't like to talk to each other.
They don't.
Yes.
They don't, yeah.
And then they don't like to be talked to.
Because they're experts.
Thank you. Professors. Nothing personal. I belong to that category. But I noticed that as an innovation agency, as I try to speak to institutions about innovation efforts and entrepreneurial leadership and transformation, I figured that there was a challenge because you're talking to them. Now, then we said, okay, can we start talking to one another? And my job now is to create a framework that enables you to talk to one another. So we then set up a trust. We call it Network of Entrepreneurial Leaders. And we said, you guys, you are now the ones organizing. Me, I'm secretary. You get a chair, you get a vice chair, and so on and so forth. We will shape the agenda, we agree. And the powerful thing, because I'll give you classic examples of what I've seen as a result of that network. Collaboration has significantly increased between the institutions. Something that amazes me is if you go to Dedan Kimathi, you'll find coffee.
Yeah.
They actually have the entire value chain for coffee and produce high quality, premium coffee. Will you find it in any other university so that you consume it? So why does it end in one university and that's it? It's because there was this thing of, that's your thing, we do our thing, and you do your thing. But all of a sudden, now it's now possible to say, by the way, why don't we have Dedan Kimathi coffee? Yes. And now all of a sudden we are a team. It is our responsibility. We are the one to build this ecosystem. And that is gradually replicating in the Pan-African network, where now members are saying, it is our responsibility. We can receive funding and support from somebody, but it is our responsibility. You pull here, Ubuntu spirit, let's make it better. You do your part, I do my part, we make something greater than the sum of the parts.
Yeah.
That's exciting.
That's very exciting. Yeah. Evelyn, I want you to close this conversation and I want you to speak to your colleagues, to scientists, in this context and borrowing from what we are hearing in this conversation and from your experience over many years.
Yeah.
If I'm a scientist today, what are some steps I need to take to be able to create this value and to deliver it to the market sustainably?
Yeah. I mean, I'm really excited with how Tonny has framed the way the network is working, because one of the things we do as a foundation is we work with consortia. So like one of our big consortia's models is we're funding 14 consortia. They're working in 89 institutions across 35 countries on the continent, right? So they're delivering on, in the last 5 years, over 200 PhDs. So the question now is for us to say, these PhDs, they already have the collaborations cross-country, not within country collaborations, mainly universities and some public research institutions. They need to think about the catalytic grant that we give, because ours is catalytic. It's supposed to catalyze. We've been funding some of these networks for 10 to 15 years. We're now asking them, the way we had framed it to be a 20-year venture, what are they doing so that at 20 years, SFA can exit, but they would continue these enterprises that they're building. So I'll have a conversation on the side with Tonny after this, because I think he has something there. But I think it's now what we're saying to them is, in the next step, we're going to not just give you funding to do the usual funding the PhDs. We're going to say we have a pot of money. And this pot of money, you can only unlock it if you come with either government investment, because many of them are very senior research leaders. So I don't know if they've become entrepreneurial enough to be hungry. So how do we get them to be hungry for the funding we're giving? How do we remove that complacency of getting, we know SFA, if we do a good job, we'll get another $7 million for another 5 years. Is we're going to create a pot of money that they can only access if they come with a sustainable model of fundraising or building, even building those enterprises within their universities that would build an innovation fund, right? Or a fellowship program, etc. So we have to change how we also catalyze. And I think that's the first thing we're going to do. So I'm a chemist. If you add too much of a catalyst, what happens? It explodes, right? This is where we are currently in the global shift in terms of the funding, is that we've put too much, we've catalyzed too much without really thinking about the end product and how we get to the end product. And so this is now where we're saying the shift is we need to catalyze in a manageable way so that we get to the end product so that we don't explode. And so that's what we're asking the universities we're working with, the leaders we're working with, the research leaders who are great. Some of them have created institutes like WACBIP in Ghana. What can you do next? Can you bring you are a technical advisor for your president. Are you trying to tell me you can't unlock some government funding to match what we're giving you? Private sector are there waiting. So it's the change. The change for us is how the business model has to change for us as funders. And that means we can't this codependency that we've developed needs to change. And therefore, when we fund, it's with the end game is not you will get another grant that is 2 million if you finish your 200K. It is you will only unlock 2 million if you're bringing even, I was telling the PS in Kenya for science and innovation that even tell us 20,000, then we'll unlock the million.
Yeah.
From a government perspective is now we're saying to them, we're matching the funding of whatever you come with. So Rwanda, for example, in our climate and health fund for innovation has already committed up to $800,000. Wow. So if the government is saying that, then we of course have to put money over. So we are also going to, for any Rwandese grantee that we get, we will also match that. So Rwanda are going to really tap into our fund because they've committed 800,000. That for me is the model that will work. This matched funding, this catalytic funding is the only way we can build that ecosystem. And then lastly is the standards. From a researcher perspective, the things that have been barriers is we don't know how to manage money. We don't know how to... I'd be interested in the maturity framework that Tonny talked about because we've just launched a good research management practice as a standard from an African perspective. Embedded in that is actually an innovation checklist, and it's a standard that is going to go global. But that's what we're saying. If we manage our research enterprise correctly, we will unlock funding. And so the standards, the ecosystem has to be built alongside the funding models that we're building. Yeah.
Thank you very much, Evelyn. This is such a lovely way of finishing this conversation. So we started out by saying innovation is under pressure. But you guys are saying it's actually a good pressure.
Yes.
In fact, we needed this pressure.
Exactly.
It's not a crisis, it's a gift.
Yes. Yeah. And an opportunity.
It's a great opportunity. And I like the way we are concluding this conversation because we are saying, number one, let's collaborate.
Yes.
Because we all have success and we can replicate those successes across the board.
Exactly.
Within countries and across countries. We are also saying that let's catalyze more success by using the resources we have to unlock more resources. And in fact, where Tonny said grants created complacency, we're not going to get rid of grants totally. We still have some money. But let's use that money to unlock local resources, both within the public and the private sectors. And that way we're going to be able to finance the value and then, we'll build economies. Thank you very much, ladies and gentlemen. This has been an awesome conversation. I've really enjoyed it. It's the first of several episodes on the sidelines of the IDIA Summit. And looking forward to the rest of the discussions, but you guys have set the pace. Thank you very much.
No, thank
you
so much for
I also learned a lot. It was a great...